going to show you another parasite that came out of a man's nose, and I'm going to describe to you various symptoms that this parasite can show or can present. So let me show you this right now. Okay, it's disgusting. It's brown. You can see a form in there. Of course, parasites make mucus. That's their home. They live in mucus. And this can cause a wide variety of symptoms. So, for example, sinusitis, right? Nasal congestion, sinus pain, pain anywhere in the sinuses. Okay, but I have a whole list. But before I get into that list, the whole idea is that this is a cause. So there are organisms that cause problems. There are toxins that cause problems, and then the diet. Those are the three major causes of chronic disease, chronic illness. And when you look up, I searched sinusitis, and Mayo Clinic came up on my Google search. And you read through the standard medical care, and they talk about getting an endoscopy. So they put a scope down there. They're not going to find a parasite that way. That thing, when you look at it, let me show it to you again. It looks like snot, and it's embedded like along the tissue. And I've had a patient one time, she got a scope in her intestines because she had intestinal problems, and they did find parasites, and they put that in the report. They typed in several symptoms, several problems that they found with the scope, and parasites was one of them, and they just handed her the report. They never said anything verbally to her. They just think that it's normal to have parasites. So even if they do find something like this, are they even going to talk to you about it? They think it's normal. Okay, but this is certainly not normal. You want to get this stuff out. So you get the scope, you can get a CT scan, you can get surgery. They'll say that your sinuses are, you get the bumps are too large. You know, they'll do surgery to reduce the, I forgot the term. And they may even do some allergy testing. They may think it's seasonal. They may think it's a food allergy. And then the solutions would be a neti pop, keeping it moist, resting. If it gets bad, then steroids, of course, decongestants, antihistamines, antibiotics, allergy shots. And these are all not good. They hardly work. And I've, been in this healthcare field since 1997, been studying it since 1993. I have people all the time, they come to me and they're frustrated because the surgery didn't work. I'm putting to my list here. The surgery didn't work, and the decongestants and the antihistamines, they need to take them like all year long, and it doesn't heal it. It doesn't fix the problem. And they're not finding the cause, and I'm going to use the term why. They're not finding the why. Why are these symptoms there? And if you find the why, the correct why, then that opens up the door for a correct handling. And when I say handling, I mean fixing the problem, and the problem is gone, it's done, it's solved, all set. So that's what that means. So the parasite issue can cause multiple diagnoses, so sinusitis being the first one I mentioned, and that just describes the symptoms. So itis means inflammation, sinus. That means they have inflammation in their sinuses, and therefore they have symptoms like pain and maybe runny nose. Okay, so what other symptoms can that parasite cause when it's somewhere from here up? The parasite was in that man's head from here to here. That's where it was hiding. And it could have been in the brain, could have been in the ears, could have been in the eyes. So the company I've been working with to get these parasites out, they're called Cellcore Biosciences. I'm a part of their Facebook group for practitioners. And one guy pulled a parasite out of his eye. This is about 4 days ago. And he showed a picture of this parasite on his fingertip. And he looked close enough. He said, yes, this is absolutely a parasite out of his eye. Sure, why not? They go wherever they want to go. They're like snakes in the jungle. They go up in the trees, they're in the water, they're on the ground, and they go wherever they want to go. Okay, so let me just and I just jotted these down. These are diagnoses that can come from a parasite from here up. So seizures. Certainly parasites can cause seizures. Seizures are brain inflammation. And I mentioned in an earlier video a week or so ago, I have a guy who has pulled 10 to 20 parasites out of his nose over the course of 3 to 4 weeks. And they're about an inch long. They have a little black line in the center that could be like the digestive system or something. And so, like, what symptoms is that causing? And if he goes to an MD, which he did, they're going to list out all the symptoms in Greek terms and, you know, like the fancy medical terms. And it's not going to mean anything because it's not getting to the cause or getting to the why. And next one is red ears. So inflammation in the body could be red ears. It could be a rash in the skin somewhere else. It could be redness around the eyes. Now, I tell you, I had parasites. I know I've had parasites since I was a kid. And one of the symptoms for children with parasites is they pull out their eyelashes or their eyebrows. And that is something I did. I pulled my eyelashes out and my eyes were beet red, right around the eyelids. Okay, next one, vision problems. So that could be a depth perception, like 3D sort of vision problem, or it could be then the seeing the aura. So like before a seizure or before a migraine, somebody will start looking around and they're seeing things floating around. It could be floaters. But neurologically, if they don't have any floaters inside their eyeballs, then they could have like, seeing things because their brain is inflamed or their eyes are dysfunctional. Next one is dilated eyes. And that could be related to adrenal function. So when parasites are having a party inside your body, that's a stress. Your body puts out more cortisol. Your adrenals put out more cortisol. Your eyes get dilated. Grinding of the teeth. This is a classic symptom of parasites from here up. Those parasites love the muscles that are here and up here that close down the jaw. These muscles are super strong. And I can go into whole stories to demonstrate how parasites love those muscles, but I'm not going to get into that. I've done it in a previous video. Allergies, I already mentioned this, but like could be seasonal, and it could be food. It could be right after a meal. It could be related to the week of or the month of the year. It could be related to if you're in your bedroom that's dusty, or if you're in the sunroom which is not dusty. So it could be dust, it could be mites, it could be, and your body is overwhelmed already with a parasite or parasites plural. And your body is then receiving dust or it's receiving pollen and it's overwhelmed. And so you go to the doctor and say, oh, you have allergies. Here's your allergy medication. They've completely missed the parasites. Next one, sinus headaches. Could be here, could be here. Or it could be anywhere, any headaches, anywhere in the head. Could be from parasites. Now, there could be other causes or otherwise. It could be fungus. It could be viruses. It could be toxins. All right, but I'm just kind of focusing on parasites right now because I got this incredible picture right there. I just received that by email a few days ago. All right, bags under the eyes. This is a big deal. Now, if it's bags under the eyes, there could be parasites in the sinuses or in the intestines. And then the person has, even if they don't have any constipation, you could just be so filled with parasites and mucus in your intestines that it shows up here. What are they going to do in medicine for bags under the eyes? They're going to inject something in there to lift it up and change the color. It's totally cosmetic. It's completely not even acceptable as a medical therapy. Like, they got to be smarter than that. They got to, and there's doctors going back 80 years, 150 years, 2,000 years talking about parasites. At what point does medicine learn? The next one is dandruff, for example, which is a mold issue. And parasites hold on to mold. Mold is or fungus. It could be on the parasite or in the parasite. So, or white coating on the tongue, again, related to parasites. Weak immune system, related to parasites. Constantly having colds, the common cold or something like that. Now I'm going off my list. I'm done with. It could be a chronic cough. That could be a parasite. So these are creating mucus, which drips down the back of the throat. It's called postnasal drip. And then the person's trying to cough because there's a tickle in the back of the throat. That could be parasites in the sinuses. Nightmares. Sure, why not? When the brain is inflamed and there's something wrong from here up, nightmares can certainly be a problem. That's when people wake up in the middle of the night, their eyes are big, and they're sweating, and they say they have anxiety. Sure, parasites. It makes sense. It makes sense to me because of my experiences in 20 plus years in the holistic field, trying to put symptoms together with causes, trying to do this, make this puzzle make sense. Next one, brain fog. Clarity of, lack of clarity of thought, or slowness in processing, slowness in short-term memory and retrieving words, and then other brain problems like maybe even dyslexia, crossing numbers, crossing letters, crossing words when reading. These are all could be symptoms from parasites. And then there's other causes that do equal amounts of damage, and they're equally ignored by conventional medicine: heavy metal toxicity, chemical toxicity, and I already mentioned mold fungus, also the chronic viruses, and there's that term myalgic encephalitis. Did I say that right? And it means encephalitis is the brain is inflamed, and that could be caused by XMRV. There's studies on that. That's what Judy Mikovits got famous for this past spring. She's saying that there's this retrovirus that hangs out in the brain, and it's causing potentially autism, ADD, fibromyalgia in the muscles, chronic fatigue syndrome. So again, my point here is that we got all these symptoms, and the symptoms are converted from one word, such as, I have sinus pain, and there's converted to a diagnosis. Oh, you have sinusitis. And even if they did a scope or a CT scan, this diagnosis is still sinusitis. They could call it inflammatory sinusitis. They can call it idiopathic sinusitis, like we don't know the cause of it. But it's the diagnosis is still a description of it. So what about the cause? What about the why? And that's a finite number of causes. It's not a huge number. What's confusing and what's intimidating and overwhelming about medicine is that there's all these symptoms from head to toe. Could be psychological, mental, could be physical, could be in the viscera, in the abdomen, lung, heart, break down all the systems, break down all the organs, and then what can happen to them, what they look like underneath a microscope, how they function or lack of function. And there's all these symptoms, just thousands of them. And you just look at, the diagnostic codes that insurance company uses. But then the causes are like just a small number of causes. And, within those small numbers, like heavy metals, then there's 12 heavy metals or less. Within the chemical the chemical poisoning department, there's a lot of chemicals that can cause toxicity in your body, but the solutions are quite easy. The solutions are a small number of supplements that do a really good job, plus a healthy diet. So it's not so overwhelming in the alternative healthcare field. Now, when I bring this up, when I looked at that Mayo Clinic website on their procedures and their discussion of sinusitis, at the very bottom of that website, it said there are no alternative therapies proven to relieve the symptoms of sinusitis. It's like, well, that's the message they want you to know of. And it's completely false. There's lots of solutions. There's actually lots of research on it. And it's in books. I got books from the 80s and earlier that have solutions for sinusitis. And there's solutions on PubMed. It's alternative therapies. But when you get into something like that Parasite, let me just show it to you one more time. How astounding is that? Like, am I pointing to it? Like, that is amazing. And and I've been through it, right? I've had 2 parasites come out of my nose with these products from Cellcore Biosciences. And the relief is amazing. So then I would intentionally cheat by having a whole container of cottage cheese and strawberry milk with all the sugar and all the goop that's in the, dairy in milk. And I had no sinus problems from consuming that. Whereas before I blew those parasites out of my nose, I had all kinds of trouble all the time. All right, so there's that. Thanks for watching. It's been 15 minutes. And I'm using this new eCam software. I think it's working out pretty good. Hopefully it comes through on YouTube fine. And then I'll see you at the next video.